Hello everyone, Dr. Scherer here. Yesterday I took the day off from making a video because I had to take care of my kiddos' own health. Don't worry, they are fine. Okay, so Governor Pritzker just announced that we're shutting down the state, or sheltering in place, I should say. This is not unexpected. It seems crazy to think that businesses are going to have to close that are non-essential. We won't be driving around as much anymore. So what I wanted to do was spend today to tell you why Governor Pritzker made this decision, or at least why I think he made the decision. You may have seen my video on ABC Chicago if you watched the link. Well, today NBC5 interviewed me and we discussed how we are going to see us moving forward to a time when it feels like wartime. So bear with me as I give the gloom and doom, and then we will see how we can move on and that everything is going to be okay. So, as you know, I have been begging and pleading on Facebook and on the news for us to find more N95 respirators for our healthcare system. I am incredibly mad at the federal administration because we are very ill prepared for what lies ahead. You may feel like I am overreacting, but we don't have cases here in Southern Illinois yet. Well, I have colleagues I have trained with that are in the hot spots of the country. They are in the heat of it. And they know what is coming to us. It is not as if this is a hurricane and as it gets closer to inland that it will die down. The hurricane will hit us too. We have already run out of equipment for doctors and nurses and staff up in Chicago. So what does this mean? The medical professionals are walking into the risk of getting an infection and knowing that it is spreading. Yesterday, the CDC said we could wear bandanas instead of these masks. Evansville Hospital started recruiting people to make homemade masks. This is because we will need to cobble together our own protective equipment to survive this until the government can provide. The order has been placed to rev up production. We are already out of supplies, and now it's time to turn the machine on to make more. Well, it's probably not that easy to just turn a machine on. That being said, as a nation, we will lose healthcare providers to this illness if we do not step up. What that will do is call upon less skilled physicians caring for the sick ones later on. We need this equipment and we need it now. So I have resigned myself to making my own hazmat suit with a Tyvek suit from Lowe's and a face shield from Rural King and masks that I got at the auto store. Okay? I'm going to cobble together my own suit. And when the federal government drops one off at my door, I will change into theirs. Also, we are likely to see hospital equipment being taxed to the max, but we need the personnel around to take care of the people. So our protective equipment is a very important priority. This virus is not an easy thing. Projections are that between 50 and 70 of us will get this virus. The good news is some of us won't feel the thing and may have already been exposed. Some of us will get a flu-like illness and we will have a fever, headaches, coughing like crazy and have to stay home and recoup. The reason for the shutdown is because we need to slow the spread to help us get ready, help prevent a lot of old elderly people from getting infected all at once. For us to cobble together our own homemade hazmat suits while we walk into this endeavor. You may not see this from the medical establishment locally at this point, but it is real across the nation. We need time to get more ventilators made because if we can treat you, even if you are a super sick person, you have the best staff working on you and the possibility of surviving this. The closure is to elongate how long this virus will take to spread. If 7 out of 10 people will get it, we need some to get it today. We need some to get it next week. We need some to get it next month. Projections are that if we can work together and treat this virus over the next 12 to 18 months, that's right, I said 18 months, we probably could cut the mortality by half. The lowest projections I've seen have been in the low 100,000, about 125,000 people are going to die from the coronavirus. The high projections, if this is an absolute disaster, are potentially up to 2 million Americans. If we all get sick in 6 months, we will lose a lot of people that we love. If we can spread it out, conserve our precious resources, we stand a chance of less people dying. So while it's inconvenient, this is the reason for the lockdown. taking a huge toll on our economy. We're going to struggle to pay bills. We're going to struggle as we watch the stock market crash. We're going to wind up having to really tighten our purse strings and figure out how to survive. But here is what I know. We were overscheduled as Americans anyways. Now we're forced to slow down. We were wasteful Americans. Now maybe we're eating food that we would have thrown away or kept in our cupboards for another 5 years. We see a need to make masks and we get inundated with them. We see a need to help our neighbors and we do. We will need to do this more and more in the coming months. This will potentially be a longer term situation. Not necessarily the lockdown, but realizing that we need to slow down as Americans and stop spreading this virus. An epidemiologist thinks we might not be done after the first lockdown, but we'll just take it one day at a time. So times will change and we will think back, remember what it was like before the coronavirus, and remember how we got back to being better human beings after. Here are the things that I am grateful for. This is the part to cheer you up after the doom and gloom. If you get the coronavirus and you're really sick, there are doctors, nurses, and medical professionals who will risk their own lives regardless of the equipment that they have, risk bringing it home to their families because they are there to help you. If you get sick and need care, you're in the best country in the entire world with the smartest minds. We're figuring out how to connect 4 ventilators together onto 1 unit. We're brainstorming on how to make this happen to keep as many people alive as we can. When people see a post about making masks, people rally around to start sewing. We are forced to see our families more. Maybe we'll stop, slow down, talk, and eat a meal together instead of running around ragged. Maybe when we're forced to be on our house, we learn how to cook and prepare meals like Grandma did. And maybe we turn the tides of our country's health conditions like diabetes and heart disease. When we're forced to be at home, maybe we plant our own gardens and start growing our own food to be more reliable upon ourselves. Maybe as we prep a bunch of new equipment and supplies in the US, we learn that sometimes cheaper isn't always better and outsourcing manufacturing doesn't necessarily pay. Maybe we learn that we don't need to spend our money on frivolous things. Maybe we learn to consume the stuff that clutters our house. Maybe there are silver linings in this pandemic. Generations before us have lived through worse. They have risen from the ashes. They have provided examples of how not to panic, but how to be better human beings and take care of one another. So tonight, I ask you to hug your loved ones, pray for those that are sick, pray for those that are caring for the sick across the world. Realize that I am not trying to be an alarmist, but rather a realist. I don't tell kids that vaccines won't hurt. I tell them it is going to hurt. It's a needle, but it's there to protect you, and it's worth it. The lockdown and the pandemic will hurt, but it is for the betterment of all of us. Wash your hands, God bless, and see you tomorrow.